Hi, my name is Savik Ganai, and I'm a surgical oncologist. And this month we're going to go over the nuts and bolts of fellowship. Now, it really was in the 1960s that a lot of the question and debate about surgical subspecialization occurred, and that was had a lot to do with the fragmentation of departments into divisions of orthopedics and neurosurgery and ENT, and what was going to happen with general surgery as its own specialty. And note that a lot of those surgical subspecialties, as we now know them, had their own board certification process well before the American Board of Surgery was developed for general surgery. Right now, the path to fellowship after general surgery is very various and diverse, and we've attached a table to our website on Residents Corner that kind of goes over a lot of the different options in terms of fellowship pathways, and some of them are ACGME accredited, such as going through a colorectal pathway and now the new pathway to surgical oncology, and others are not necessarily ACGME accredited, but have their own accreditation standards, and that includes the Fellowship Council's MIS pathway, as well as HPB fellowships. There are a lot of other options, including going into breast surgery or endocrine surgery, and you can see that a lot has to do with what your focus intends to be, whether it be focusing on an organ system, whether or part of the body or technique. If you're more interested in diseases of the hindgut, a career in colorectal surgery may be more appropriate. And foregut, it may be helpful to consider an MIS fellowship after residency. One thing to note is there are certain fellowships that have followed the more or less integrated pathways, and that includes thoracic surgery and vascular surgery, where there are certain programs that allow early specialization, so completion of 4 years of residency, and then focusing on a 2-year fellowship in vascular surgery afterwards. So there are some pathways that have gone fully integrated, and after 2015, plastic surgery will be able to be only entered from after medical school straight into a plastic surgery residency. Some of these programs also exist for vascular surgery as well as cardiothoracic to enter straight out of medical school. And then there are certain programs, including pediatric surgery, that are currently, the expectation is to complete a 5-year residency program followed by a 2-year fellowship or residency in pediatric surgery, but there may be options for doing a 4+2 in the future in terms of early subspecialization. So there is a lot of options currently, but there are some that require thought and planning, even from the point of when you may still not know what kind of surgeon you really want to be. So these are some of the questions that we'll be exploring in the future at Residents Corner at the SSAT. Thanks.